Hi, I'm Katie, Elemental Health's AI Guide. One of the most common questions we receive from patients is, what's the difference between a medically guided ketamine session and a therapist-guided ketamine session? Both approaches can be incredibly beneficial, but they serve slightly different purposes depending on your goals, comfort level, and treatment needs. A medically guided ketamine session focuses primarily on the medical administration, safety, and physiological effects of ketamine treatment. During these sessions, our clinical team monitors your vital signs, adjusts dosing as needed, and ensures that your experience remains safe and supported throughout the process. These sessions are intentionally designed to be more introspective and inward-focused. Many patients choose to relax quietly with music, an eye mask, or calming sensory tools while allowing the medicine to work. In medically guided sessions, staff are always immediately available, but they may not remain in the room continuously. The focus is on creating a safe environment where you can process internally and experience the therapeutic effects of ketamine with minimal outside interruption. For many patients, this is more than enough support, especially for those who are comfortable with introspection, meditation, or independent emotional processing. Therapist-guided sessions, often called ketamine-assisted therapy or CAT, include all of the same medical safety and monitoring components, but also involve direct emotional and psychological support from a trained therapist, guide, or integration professional during the session itself. In these sessions, the therapist may help you prepare intentions beforehand, provide grounding or reassurance during difficult emotional moments, and assist you in processing insights or emotions that arise while under the medicine. Some patients find this especially helpful if they are working through trauma, grief, anxiety, relationship concerns, or deeply emotional material. Therapist-guided sessions tend to be more interactive and relational, while medically guided sessions are often quieter and more internally focused. Neither approach is better. They are simply different tools designed for different needs and preferences. For example, some patients prefer medically guided sessions because they enjoy having private space to journey inward without conversation. Others feel more comfortable having a therapist physically present for reassurance, emotional support, or integration assistance throughout the experience. It's also important to understand that ketamine itself is still doing the same neurobiological work in both types of sessions. The medicine is still promoting neuroplasticity, supporting healing pathways in the brain, and reducing symptoms regardless of whether a therapist is present. The main difference is the amount of emotional guidance and active therapeutic support provided during the experience. Many patients actually use both approaches at different points in their care. Some begin with medically guided sessions to become familiar with ketamine, and later add therapy-guided sessions for deeper emotional exploration. Others alternate depending on what they need at that point in their healing journey. At Elemental Health, our goal is to customize treatment to your individual needs. Whether you choose medically guided sessions, therapist-guided sessions, or a combination of both, our priority is helping you feel safe, supported, and empowered throughout the healing process.
We are happy to provide more resources or answer any questions you may have, and can be reached at 208-801-1414.